Kidney stones are a common yet painful condition that affects millions of people worldwide. These hard mineral and salt deposits form in the kidneys and can cause discomfort when they move through the urinary tract. Now, the pain that these pesky stones cause is not the only sign you should be aware of. There are several other symptoms that could indicate the presence of kidney stones in your body. Identifying these symptoms early on can help you seek treatment and prevent any complications. In this video, we'll explore the top 8 symptoms of kidney stones so that you can catch them before they become a major problem. Whether you're experiencing unusual pain, changes in urination, or other related symptoms, understanding what to watch for is the first step in addressing this condition effectively. So, without further ado, let's start off with
Number 8. Hematuria. One of the most noticeable symptoms of kidney stones is the presence of blood in the urine, or in scientific language, hematuria. This occurs when kidney stones irritate or damage the delicate lining of the urinary tract as they move through it. Depending on the severity, hematuria may be easily visible as a red, pink, or brown discoloration in the urine, often described as tea or cola-colored. In some cases, however, the presence of blood is microscopic and can only be detected via lab tests. Blood in the urine can be alarming, but it's a clear sign that something is not right. Kidney stones form when minerals and salts in the urine clump together, creating hard deposits. As these stones travel through the urinary system, they can cause small tears or abrasions, which can lead to bleeding. If brushed off, this condition can result in complications like urinary tract infections, in short UTIs, or more significant kidney issues. If you see any changes in your urine color, or if you experience any discomfort while urinating, don't just close your eyes and deny the possible situation. Doing that only leaves the condition undiagnosed. So, speak up to your doctor and get it checked if you love your life and the one you love. Life is pretty short, so don't take this risk. Number 7. Nausea and vomiting. If you've ever had kidney stones, you might know that they can cause more than just pain. They can also make you feel nauseous or even lead to vomiting. But why does this happen? Well, it's all connected to how your body's nerves communicate. Your kidneys and digestive system share a complex network of nerve connections. When a kidney stone blocks the urinary tract, it triggers distress signals that your brain picks up. These signals can confuse your body, leading to that queasy feeling we call nausea. Sometimes the discomfort is so intense that your body reacts by vomiting. This is a natural response to severe pain or irritation as your body tries to cope with the stress caused by the stone. For those with kidney stones, the sudden onset of nausea and vomiting is often accompanied by other symptoms such as sharp pain in the lower back or abdomen, blood in the urine, fever, chills, or foul-smelling and cloudy urine. These signs collectively indicate the presence of a stone that may be causing a blockage or irritation within the urinary system. It's essential to address nausea and vomiting linked to kidney stones promptly, as ignoring these symptoms can lead to complications such as infections or kidney damage. Seeking medical attention ensures proper treatment, offering relief from these distressing symptoms and preventing further health issues. Number 6. Cloudy urine. Have you ever noticed your urine looking cloudy, milky, or hazy? While it might seem harmless at first, this can sometimes be a sign that something is going on inside your body that needs attention. While occasional cloudy urine isn't usually a cause for concern, recurring episodes should prompt a closer look at what might be happening. One of the most common culprits of cloudy urine is an imbalance in its chemical composition, often due to high levels of alkalinity. Urine is primarily made up of water, salts, and waste filtered by the kidneys. Its pH level typically ranges from 4.5 to 8, with acidity below 5 and alkalinity above 8. When your diet is rich in fruits and vegetables, which are alkaline-forming, this can alter your urine's pH and cause it to appear cloudy. This effect can be amplified if you consume fewer meats, grains, and cheeses, which tend to make urine more acidic. Medical conditions can also play a significant role. For example, diabetes can lead to excess sugar in the urine, which can result in a cloudy appearance. Chronic kidney disease, in short, CKD, UTIs, kidney stones, and preeclampsia are all known to trigger this symptom. Certain medications, like oral diabetes treatments, laxatives, phenazopyridine, warfarin, and rifampin, may also contribute to cloudy urine as a side effect. It's important to note that sexually transmitted infections, STIs, such as chlamydia, gonorrhea, and vaginitis, may cause cloudy urine as well. However, cloudy urine in these cases is often accompanied by other signs, making it a valuable clue for healthcare providers in diagnosing an STI. While cloudy urine might seem like a minor issue, it's essential to keep track of any accompanying symptoms, such as pain, unusual odor, or changes in frequency. If these occur, consulting a healthcare professional is crucial to identify and address any underlying conditions promptly. Taking action early can help prevent more serious complications and ensure your urinary health stays in top shape. Number 5. Urine odor. Have you ever noticed a strange odor in your urine and wondered what it might mean? Urine is mostly water, but the rest is made up of waste products filtered by your kidneys. These waste substances, along with how much water you drink, play a big role in how your urine smells. When you're well hydrated, urine is diluted and typically has little to no odor. However, concentrated urine, where there's more waste and less water, often has a strong ammonia-like smell. Sometimes the foods, drinks, or medications you consume can change the odor too. For example, asparagus, coffee, and certain vitamins are famous for causing noticeable and sometimes surprising changes in urine scent. Rare metabolic disorders, such as maple syrup urine disease or phenylketonuria, PKU, produce distinctive urine smells due to the buildup of specific substances in the body. Similarly, poorly managed type 2 diabetes may result in sweet-smelling urine, indicating excess glucose. A gastrointestinal bladder fistula, an abnormal connection between the intestines and bladder, can also cause foul-smelling urine due to the presence of intestinal bacteria. Monitoring changes in urine odor, especially if accompanied by other symptoms like pain, fever, or discoloration, is essential. Such changes may provide valuable insights into one's health. Consulting a healthcare professional ensures proper diagnosis and timely treatment, preventing potential complications and maintaining overall well-being. Let's move to the next symptom. Number 4. Fever causes. Have you ever wondered why your body feels hot, achy, and chilly when you're sick? Fever, also called pyrexia, is your body's natural defense mechanism against infections and illnesses. It happens when the brain's thermostat, the hypothalamus, raises your body temperature above the normal range to help fight off invaders like bacteria or viruses. Normally, body temperature hovers around 36.5 to 37.5 degrees. But when it climbs above 37.2 to 38.3 degrees C, you may start to feel cold, even though your body is heating up. This is because your muscles contract to produce heat, causing chills and shivers. These symptoms are part of your body's effort to reach the new, higher temperature set point. Once the issue causing the fever is resolved, the hypothalamus resets to normal, and your body releases the extra heat. You might feel warm and flushed and start sweating. This is your body's way of cooling down. For most people, fever is a sign that the immune system is hard at work and not usually a cause for alarm. However, very high fevers, especially in children, can sometimes lead to febrile seizures. Fortunately, temperatures rarely exceed 41 to 42 degrees C. Treatment for fever is often unnecessary unless accompanied by discomfort or other severe symptoms. Over-the-counter medications like ibuprofen or acetaminophen can alleviate associated pain and reduce temperature. Medical attention is crucial for infants under 3 months, individuals with weakened immune systems, or those exhibiting alarming symptoms. Fever is one of the most frequent health concerns, accounting for many medical consultations, especially in children. Despite its prevalence, fever phobia leads to unnecessary worry. While fever plays a defensive role in the body, addressing its underlying cause is essential for effective care. Number 3. Crystals in urine. If you feel crystals in your urine while peeing, this condition, known as crystalluria, is often discovered during routine urine tests. Not all crystals are harmful, some are completely harmless and may not cause any symptoms. However, in some cases, these particles can grow larger and form stones, which can block parts of the urinary tract. This obstruction can lead to serious issues like acute kidney injury, AKI, also called acute renal failure, ARF. Crystals in urine can occur for various reasons, including dehydration, certain foods, or underlying health conditions. While small crystals might pass unnoticed, larger ones can cause discomfort and need medical attention. If you experience symptoms like pain, difficulty urinating, or cloudy urine, it's important to consult a healthcare provider. Various types of crystals can appear in urine, each with distinct characteristics. Common examples include ammonium biurate, bilirubin, calcium oxalate, calcium phosphate, cystine, hippuric acid, leucine, struvite, tyrosine, uric acid, and xanthine. Laboratory tests help identify these crystals by examining their shapes under a microscope. Some crystals lack a defined structure and are termed amorphous. The urine's pH level significantly influences the type of crystals that form, as certain crystals are more likely to develop in acidic or alkaline environments. Crystals in urine can affect anyone, and their presence does not always indicate a medical condition. However, specific types, such as cystine and xanthine crystals, suggest rare inherited disorders. Additionally, individuals prone to kidney stones often have crystals in their urine. The impact of these crystals varies. Some may pass through the urinary system without causing harm, while others form larger aggregates that obstruct urine flow. These blockages can result in discomfort and require medical intervention to remove. Monitoring urine for crystals and addressing underlying conditions promptly is essential to prevent complications and maintain urinary health. Number 2. Frequent urination. Do you ever feel frequent urination means needing to pee more than 7 to 8 times a day, which can be both inconvenient and disruptive? While it can happen to anyone, it's more commonly seen in older adults, pregnant individuals, and those with an enlarged prostate. The most common cause is a UTI, but other factors could also be at play. Conditions like diabetes, overactive bladder, or even drinking too much fluid can lead to this symptom. Sometimes, frequent urination is simply a temporary issue, but in other cases, it may signal a more serious underlying condition. Although it might seem like just an annoyance, frequent trips to the bathroom can interfere with your daily activities and cause discomfort. The reasons for this issue vary widely, and identifying the cause is key. For example, if a UTI is responsible, antibiotics can help resolve the problem. If it's linked to another condition like diabetes, managing that condition can reduce the symptoms. For example, pregnancy can increase the frequency of urination due to hormonal changes, while conditions such as diabetes, an overactive bladder, or prostate problems may also lead to more frequent trips to the bathroom. Frequent urination at night, known as nocturia, is another variation of this condition. It is normal to wake up once during the night to urinate, particularly as people age. However, waking up multiple times throughout the night can disrupt sleep patterns and may indicate an underlying health problem. Conditions such as heart failure, leg edema, swelling, and sleep disorders are often associated with nocturia, necessitating further evaluation by a healthcare provider. Typically, most people urinate about 7 to 8 times per day. If you find yourself needing to urinate significantly more often, or if the urge occurs every hour or half hour, it may be considered excessive. However, individual habits and hydration levels can also play a role. It is essential to understand what is normal for you, and any significant changes should be discussed with a healthcare professional to identify the cause and seek appropriate treatment. Number 1. Urinary retention. If you ever feel your urinary bladder doesn't empty completely or at all during urination, the bladder, a muscular organ, acts as a storage tank for urine created by the kidneys. Normally, when it fills, your body sends signals letting you know it's time to go. But in cases of urinary retention, something disrupts this process, leading to discomfort and potential complications. This condition can have several causes. Blockages, such as an obstruction in the urethra or bladder, can prevent urine from flowing out. Medications like decongestants, antihistamines, or antidepressants may also interfere with normal urination. Nerve problems, especially those linked to the spinal cord or pelvic area, can impair the signals that help control bladder function. Urinary retention can be acute, happening suddenly, or chronic, developing over time. Acute cases are often emergencies that require immediate medical attention, as the inability to urinate can cause severe discomfort and even damage to the bladder or kidneys. Chronic urinary retention, while less sudden, can lead to ongoing issues like frequent infections or a weakened bladder over time. Urinary retention can be categorized into 2 types: acute and chronic. Acute urinary retention develops suddenly, often with severe symptoms. This form is considered a medical emergency and requires immediate attention. In contrast, chronic urinary retention develops gradually, with symptoms becoming more noticeable over time. Both conditions can lead to complications if left untreated, including bladder damage or infections. Acute urinary retention is marked by the inability to urinate, even though the bladder is full. Individuals may experience extreme discomfort, as the bladder remains filled with urine that cannot be expelled. In some cases, it may cause lower abdominal pain, bloating, or digestive issues. If left untreated, acute retention can result in severe complications, making it critical to seek medical help without delay. The treatment for urinary retention depends on its underlying cause. For blockages, procedures such as catheterization or surgery may be necessary. Medications can help alleviate symptoms caused by nerve dysfunction or other conditions. In some cases, lifestyle changes, such as fluid management or pelvic floor exercises, can also help manage chronic retention. Overall, urinary retention is a condition that requires attention, as it can affect daily life and lead to further health complications. If you experience symptoms of urinary retention, it is crucial to consult a healthcare professional for proper diagnosis and treatment. That's all for today. If you find this video helpful, please like, share, and subscribe. Thanks for watching, and we'll see you soon. And we'll see you soon. And we'll see you soon.